Hello, I'm Avalon Newberry, a junior at South Tahoe High School in Sports Medicine 3. This is my fourth project on post-surgical rehabilitation for hip avulsion fractures. In this project, I am aiming to learn more about hip avulsion fractures, including the anatomy and cause of them, the surgical process, and the various rehab stages, including post-surgical, intermediate recovery phase, long-term rehabilitation and goals. And I'm really looking to better understand the mechanism of injury, rehab exercises and steps, and injury prevention in the future after the surgery. Avulsion fractures are when a small piece of bone gets pulled away from the main bone by a ligament or tendon. Symptoms of this include pain, a popping sound, swelling, redness, bruising, and limited range of motion. Some common areas are in the ankle, foot, elbow, knee, pelvis, and hip. This is seen a lot in children and teens due to growing bones, also because of sports or direct trauma. The mechanism of injury is usually a sudden forceful muscle contraction during a rapid acceleration or deceleration. The hip itself is made up of four main ligaments to provide stability: the iliofemoral, the pubiofemoral, the ischiofemoral, the ligamentum teres. Some bones are the femur, the pelvis, including the ilium, ischium, and pubis bones. The tendons that are most notable are the iliotibial band, gluteus minimus and maximus, or medius, greater trochanter. And for muscles, flexion comes from the rectus femoris and iliopsoas, extension from glutes and hamstrings, abduction from glutes and sartorius and the tensor fasciae latae, adduction from the adductors, internal rotation, adductors and iliopsoas, external rotation, sartorius and glutes. Hip avulsion fractures are most common in the iliac crest, where the sartorius and tensor fasciae latae connect, the iliac spine, inferior and superior, ischial tuberosity, and the rectus femoris. The mechanism of injury for these fractures are from a forceful contraction, usually in sprints, usually when the athlete is sprinting, jumping, or kicking, or from just growing bones and direct trauma. This is seen mostly in young athletes. It can also happen from rapid muscle exertion and a pulling mechanism. Some symptoms include pain, limited range of motion, bruising and swelling, and a popping or cracking sound. Treatment before surgery will consist of rest, cold therapy, physical therapy, modified strength and conditioning, and this will last for 6 to 8 weeks. And if this does not work, that is usually when the physician will recommend surgery. The surgery is necessary when the bone fragment is displaced a couple of centimeters from its original position, and the patient is suffering from a lot of pain and dysfunction. This surgery isn't very common, so when it is necessary, is when the PT and all of the other tries before failed. The surgical technique for this is open reduction and internal fixation. While there is an arthroscopy approach, it is not as known or used, mostly just the open reduction and internal fixation, where the surgeon makes an incision and finds the tendon and attaches it back to the bone with screws and other metal hardware. Some common areas this will occur is the ischial tuberosity, the anterior superior iliac spine, or the ASIS, the iliac crest, the rectus femoris. Some goals from this surgery are to restore function, decrease pain, return to activity, reduce complications, and prevent further re-injury. This is the surgical procedure I decided
General
to
anesthesia
pick.
is used for
This
induction,
is
a
a
longitudinal
rectus
plata and
femoris
sartorius.
repair,
The
avulsion
fascia is open
fracture repair.
SIS.
While it is the rectus femoris surgery, most
Next,
hip
the rectus
avulsion
is
fracture
identified, the
surgeries
tear
are
is
the same,
assessed, and the muscle is
just the
mobilized.
surgeon reattaching the tendon through sutures and then
Adhesions are
hardware
released from the
later
surrounding
on.
structures. Improve the visibility. The footprint is cleared until bleeding, healthy bone is observed to support healing. Preparation for the suture anchor. The anchor is Practices then slid down the suture and tightened to restore. A general anesthesia is used for induction.
The post-surgery rehabilitation plan is to manage pain and start early mobilization, then to increase to isometric exercises. From there, go to range of motion exercises, and then increase to strengthening, then flexibility, then functional training, and finally sports specific conditioning to get the patient cleared and back to sports. The timeline of this is the post surgical phase usually lasts for about 0 to 3 weeks. In this 0 to 3 weeks is usually when you'll see the pain management, mobilization, and isometric exercises at play. The next 3 to 6 weeks is the intermediate phase where you'll see more range of motion, flexibility, and strength. And the long term rehab will last about 6 weeks to 6 months, depending on the patient. And this will consist of functional training and sports specific training. It is important to note that every person heals differently, so this timeline can be a little skewed depending on the patient's necessities and ability to complete each of these tasks. For the pain management and mobilization, for the first 2 weeks, you'll be in the hospital for around 2 to 3 days, where the doctor will prescribe you with prescription drugs, usually opioids, and you can also get NSAIDs like ibuprofen or Advil or Tylenol to help with this pain. Ice packs every 20 minutes will also help with pain. And then early mobilization like crutches and a walker and gentle range of motion, which the nurses at the hospital will help you with and give you a plan for. You definitely want to make sure you have the right form for everything and avoid dislocation or re injury. Some isometric exercises you'll see are hip adduction, hip abduction, and quadriceps. It is important for these we do these exercises for muscle activation and strength around this injury, but we don't want the joint to move. You'll typically see these exercises being done in weeks 2 to 3. Again, it depends on the person, but not really putting any stress on the injury site or the joint around it, just trying to strengthen the injuries and the muscles without re-injuring. For some range of motion, this will typically be seen in weeks 3 to 4, and this is used to gradually restore movement, prevent stiffness, and to really promote the healing to regain normal function and strength and flexibility again. It is important because it helps improve blood flow, muscle strengthening again, and pain management. Heel slides are a really common exercise just to do a little thing and get the leg moving and the blood flowing. Same with sitting hip flexors. And one of the most common starts to physical therapy after hip surgery is pool therapy or aquatics. This will help because you're not putting as much stress on your legs and you can do many different things. For my strengthening exercises, this will usually be around weeks 4 and 5.
Long lever bridge, double leg isometric, marching.
The goal of this is to rebuild.
Single leg isometric.
The goal of this is to rebuild muscles around the hip joint, and some common exercises are a clam progression, hip thrust progression, and balance to really just focus on the glutes and the quads and hammies. It's important to note that you need to start off, that your physician will advise you start off with less and can go to more. With the clam, you'll start unbanded and unweighted and slowly progress into more and more.
Long lever bridge, double leg.
For some flexibility exercises, this will be seen around weeks 5 and 6. Flexibility is important because it can help relieve pain and prevent further injury. Also helps restore a range of motion. And some common exercises for this are heel pulls, jackknife, hip flexor stretch, seated hamstring stretch, and upward dog to downward dog to world's greatest stretch. It is important to be working all the major muscle groups of the legs along with the core to help stabilize and support everything. Once again, less is more in the beginning stages and then slowly advancing to more and more. You can also find these videos on YouTube to help find a program and do more exercises at home to stretch. Some functional training will be around 2 to 6 months. This will help restore ability for everyday activities. Some common exercises are just walking, like on the elliptical or the treadmill, and gradually increasing with each like session. This will also be seen later on in the sports specific training. It is important to focus on each individual section, though. That is why you'll start increasing more hamstring strengths, quad strengths, glutes, and core. For some sports specific conditioning, this will be around, once again, months 2 to 6. It depends on your healing process along with everything else. These are all when this is happening when all steps are done and comfortable and the patient has made severe improvement and the physician has improved for return to sport play. It is important to avoid re-injury and gain back conditioning and have pain be pain-free or pain of less than 4 out of 10 on the pain scale. Also, to make sure the patient has correct form and movement. This is a little running progression, which will help the athlete get back into shape. It is important during this time to work on plyometrics and to correct or modify any sport-specific movements and really focus on endurance, especially leg endurance. Some statistics and surgical program effectiveness is this surgery is over 97% effective. Of that 97%, 81% has participated in post-surgery rehab. These outcomes from the surgical 97% say it's good, and 95% of people who received this injury were able to return to sports and be pain-free. There were only 26% complications from the surgery, and the correct rehab plan significantly helps, as you can see with the percentages. In conclusion, this surgery rehabilitation effectiveness is very effective. The rehab steps and plans are different depending on age, sport, and injury, but overall, this rehab plan definitely can help anyone, and the surgery is effective when non-surgical approaches fail. Thank you.